A very warm welcome to our audiences. My name is Devika Chhibber Mehta, and I am the host of the talk show of Awe, A Woman for a Woman, where we believe that every woman has a story to share through which she can transpire and inspire the society. Today, we have Dr. Mini Mehta with us. She is among the finest homeopathy doctors in the city and is known for offering excellent patient care in Delhi-NCR. Currently, she's working as a palliative care physician with Rajiv Gandhi Cancer Institute and Research Center, and also practices through her own Karisma Homoeopathy Clinic in Rohini. She has delivered successful treatment for various serious pathological conditions and genetic diseases. Integrative medicine has been at the forefront of her practices. Also, she has been successfully treating a lot of patients suffering from cancer with this approach. She has been treating also a lot of autoimmune diseases, successfully preventing further complications. She's also the recipient of many awards, including Hahnemann Award and Zutshi Award. So Dr. Mini Mehta, very warm welcome. How are you doing today? I can see you are still in the hospital. Thank you so much for staying with us and speaking to our audiences through this platform.
Thank you very much for inviting me. Yes, it was about office time, and I was about to leave, but just to be in this show, I'm staying here.
That's so. Thank you so much, Mini. And अभी कोविड चल रहा है. कोविड although अभी ओमिक्रॉन इतना माइल्ड और थोड़ा मतलब माइल्ड सिनेरियो दिख रहा है कोविड का. But how are you facing in the hospital and in your nearby area? क्या scenarios हैं? As a doctor, how are you seeing the patients coming in? या जो options available हैं hospitals में? What do you have to say about that?
अभी अगर देखा जाए तो right now, I think people are very much aware now. And everyone is very much trained how they have to start taking care of themselves once they, start feeling any symptoms of cold. Itna panic nahi hai. People are taking care, they're wearing masks and they're washing their hands. And any of the family member, once they feel like as if they are infected, they isolate themselves. So they're preventing a lot of, transmission. So basically, the situation which was last year that people were panicking, fear ho raha tha, they were rushing to hospitals. Now they know how to manage. They are very much perfect in first aid. They know what to take. Now everyone is perfect in home remedies. So as soon as they start feeling some congestion in their throat, they know that they have to take lukewarm water. So we are getting cases of common cold and also even COVID. So people are recovering fast.
Okay, but any specific challenges or any specific issues or any special case which you probably saw which was different from the other ones which you would want to share with us?
Yes, sometimes I see that there are some people who are in a habit of popping up pills on their own. Like, once they start getting some throat irritation or something, they start taking azithromycin on their own. And they will take CQ, whatever they find on net, and they surf and they eat, and then they, do a lot of harm to their body. They start having loose motions. For that, again, they take some remedies on their own. So they just, make their disease worse and complex. So I have, I've got a lot of cases where the disease was, a simple disease was complicated due to, now they were suffering drug toxicity. So we face a lot of problem. And actually, why these people keep on start this? Because they lack patience. So when they end up, messing their condition, then we start treating them with simple disease, and then they take longer time to, revive. Some people, when they have cold, they have cough, they immediately start taking nebulizers. They don't know that you catch cold and there is a phlegm and you're coughing. So take steam so that you can easily expectorate. What they do is they take nebulizer, and nebulizer is cold steam. What it is doing? It is, it is taking the moisture out of that expectoration, and it is making it settle at the lower edge of the low base of the lungs. So it can make you feel better once. But if you have a lot of phlegm, it has to come out. How will it go off if you keep on settling it in your lung? So coughing is fine.
Right, very
You
true.
can
I mean, people usually want to treat themselves. They feel that, oh, okay, I have cold, I have fever. Let me pop up the medicine, and then I'll be better. But the right procedures and the right way of treating themselves are still unknown to many of them. I agree with that.
yes,
Yes.
they avoid seeing the doctors. They don't listen to doctors. So some doctors are also, taking it easy. They will write you every medicine.
Hmm. Okay.
If you're having 100 fever, 101 fever, it's fine. You cannot die with that.
Hmm.
Start taking some, good food. If you still want to eat masala food, chop and, kadai paneer with your cold and fever, then nobody can save you ever. No medicine can save you. If you'll take proper diet, hot liquids, I, I give you this, guarantee that you will be better overnight if you are careful. 101 fever is nothing. Just cover yourself, you will sweat and you will get out of it. There is no problem. If when you don't take rest and you don't eat right, you usually complicate your situation. So in this corona times now, people have, they have learned that how they have to behave. They should have patience immediately. They should not have lot of medicines, because previously, people were popping up ivermectin, remdesivir at their home, and then they were rushing to the hospitals. Only those people are having, a lot of complaints in comparison to people who had some patience and who wanted to treat themselves with some, first aid first. So their recovery was better. So now all are, all the people are informed that how they have to do. So there are very, very less casualties. There are very less people who are getting admitted in the hospital with Omicron or Corona, whatever. People are getting fine within 5 days.
They're becoming more aware, because second wave, mostly it was said that people were very careless with their health and the medicine things and other procedures which they were adopting. Steroids were taken.
Yes, yes, they were getting careless, but they were having fear also. But now fear has turned into intelligence, and they are able to use their intelligence. They are
Thankfully,
people are getting wise.
they become more wiser, and thankfully the doctors who are helping them out, especially people like you, so it has been a boon, I guess. The first wave, it was, I mean, it was said there are many myths and there are many rumors and many sayings around all these waves coming up. So the first wave, people were saying ki it's all for the senior citizens might face hardships there. Second wave, it was talked about adults and other people. Now third wave was talked about. For the third wave, kids were specifically targeted, that okay, kids might be affected. So do you see that ratio coming up among the trends?
No, no, it was said that it might affect kids, but it has not happened. Children have better immunity than us because they hardly have any comorbidity, diabetes, because diabetes make your immunity poor, and they don't feel the fear once they get sick.
Yes.
And people, when they get sick, they immediately see themselves in the hospital. So fear makes their adrenal glands secrete more cortisol, and they complicate their things. So
So
children are recovered in.
the psychological impact is also there. I mean, people
Yes, yes,
psychologically get affected more.
fear killed a lot of people. Now this pandemic or epidemic has thrown light on the only truth that the only thing which can save you is your own immunity.
Hmm.
Your immunity is the bank balance which you accumulate by eating right, thinking right, and this bank balance you will use during your this these kind of epidemics and pandemics. If you don't have any immunity, you can't get through. So now
So
people are learning that immunity is very important, because in this pandemic you have seen that there is no medicine to treat corona.
yes.
Scientists, they have failed to find any medicine to treat corona. They are just giving you vaccine to prevent it. That has also failed. That is not also solving the purpose. People are
Not
still
100%
transmitting
effective.
disease, still they're getting infected. So
Yeah.
what was the use? So what was the use? So still, immunity is helping a lot of people. So now people know that they have to exercise. They don't have to gain weight. It's not okay to be, gaining weight. It's not okay to overeat. Now people are getting wiser. So I hope in coming years we can get more healthy community. People are joining yoga classes. They are
Hmm.
cooking themselves. They're
The last
avoiding.
2 years changed everything. I mean, it changed. There was lifestyle issue among people, and I think last 2 years majorly changed the lifestyle problem in many households, basically. So when you say eating right, what is eating right? What is the right proportion?
Right proportion. Eating right is eating when you feel hungry. And when you feel hungry, don't eat any, factory made food, preserved food. Always try to eat freshly cooked food.
Okay.
Within hours, you should be able to consume that. You are feeling very hungry, you are feeling tired, and then you grabbed a packet of cookies and you're eating chocolate cookies, you're eating hide and seek biscuit, and you're done. So, what is this hide and seek going to give you? It's not going to give you anything. But if you'll eat some food, some vegetables, some chapatis, it is going to serve, the purpose.
Some purpose.
So when you are so hungry, you should not grab any spicy things. Spicy things. You don't know when to exercise. You cannot manipulate your day like, whenever you're getting up, you're eating anything, you're exercising. People are learning this thing. If the community
Discipline
will,
has become important. Discipline has become a
yes,
major comeback in the lives of many households.
yes. So people are learning it. Now, because people were, getting pre-prepared food, which they had to just put in the hot liquid, rajma and everything. They were eating those preservatives. That was not doing anything. It was just going inside you and just coming out. So that's why you needed some cold drink to digest it, because
Yeah.
cold drink had sugar. So you were just consuming sugar from the cold drink, from the coffee, because food was not serving the purpose. If you have someday eaten something very good and nutritious, you won't ever feel like having tea or anything, coffee, any stimulant to digest it.
Okay.
When your digestive system is not able to, get all what it needs, then only you require stimulant or sweets after food, because you didn't get anything out of it.
So when we
So
are
this
saying
is
stimulants as sweets, basically, so this is all processed sweets we are talking about. Because earlier
refined
we
sugar.
had, yeah.
Otherwise, why would you need when you are full sweets? Sweet sugar give you immediate, hit. After a stomach full, also you need sugar. So this means there's some problem.
Okay. All right.
There's so many things people are turning towards naturopathy. They are now, valuing our culture, in which, we had a way of eating in different seasons. That इस टाइम पे मीठे चावल बनेंगे, इस टाइम पे ये है, तो we were celebrating health. इस टाइम पे फास्ट करेंगे, इस टाइम पे we'll wake up, ये कार्तिक का महीना है, तो it was very logical and scientific. So now people are again going towards that.
So we've turned back
But
to our roots.
now again, Ayurveda or the Indian system of living is served to people in other languages in modern platter.
Yes. There are so many yoga or nutritional classes going around. So people are following that. It's the same thing. Basically, it's the same thing. So
But they want it to be in a modern way.
yes. So we are in the third wave, but there are several countries which are in the fourth wave. So being a doctor, being in the profession, what do you see as forthcoming? Is there a fourth wave coming up later? Probably the variants. Do you see any change in the variants or in the immunity section of people? Do you see any forthcoming aspects?
India has, I think it has achieved its herd immunity.
Okay.
We are getting very less cases. I am in a hospital. We are not getting any, and we have no admissions right now. Otherwise, in the last time, the second wave, it was full. It was over
Does
full.
season play important role here? Because last year it was during March, April when we have that dry loo weather. So does season play a role there?
Every change of season, when you will, your body will start to acclimatize through the process of homeostasis with the outer environment. So you will have inflammation in your nostrils, in your mucous membranes, nose and throat. So it will first get inflamed, and then it will give a discharge through nose. It will run for a while, or you will have a sputum for a while, and then you are settled according to the outside temperature. This is what nature is. But if you complicate it because you were not eating right, if you complicate it because you were not wearing right, you were
Hmm.
exposed, then you will enter into disease, or you had some problems in your body already. Otherwise, people, we have a very natural power to set according to the changed environment.
Okay.
So
All
this is
right.
what happened every time in the change of season. This is what was, India had 6 seasons, so there was ritu ahar,
Hmm.
that जैसे सावन में साग नहीं. So to remain healthy, they were kind of that in this season you have to this eat this particular kind of food. So people were healthy, peaceful in India in the ancient times. They were peaceful, not destructive minded. Their stories were full of fancies, happiness, and if you see movies from the West, they have all destruction. Aliens are coming, they're destroying, because they, this is kind of food they're eating, dead,
Changes the
non-veg.
thought process and other aspects.
Season only, winter season, winter blues. So all this destruction comes from the West. But Indians, if they were following their routines, their celebrations, their way of living, which is mentioned, there was no depression. Family system. So this is all destruction, depression. These are the words from the West. Otherwise, in India, they had culture that we have to help others. We have to, if somebody dies in somebody's house, so the entire village is going for 13 days to that person. We were those kind of people, very satisfied, very peaceful, very less destructive people. Even the villains in our culture, like Ravan, was shown very wise.
Yeah. Very intelligent
He
human
behaved,
being.
he behaved with certain negative thing throughout life, but at the end he was wise. And if you get stories, the villain wins. He has a reasonable reason to become a villain. So if at all somebody wants to make a change in their life, they can't, because they have a story that no, it never happens. If you're negative, you will die negative, and it is good. So this is a difference between India, Indian people, their immunity, their response to stress. This is our
Family plays a very important role there.
in our DNA की भगवान सब ठीक करेगा. खाने से
A
सब सही
faith to
होगा.
restore, yeah, a faith to restore
Yes.
humanity, and especially it comes from the family. So you have two beautiful girls, and you were there. I mean, you were. I know that you have been working for the last year or more in the hospital environment, but you have two kids and you have family members. So how do you maintain that work balance, and how difficult it was for you? Or I mean, how was it for you for the whole experience?
Yes, actually, my family was always supportive, and when I chose this career, they were happy more than me, because I was going into a service field, which my parents also admire, and they love that I can help people, because we have also seen a lot of down times when we needed doctor, and doctors proved to be angels in our life and helped us. So when I entered this field, I we were very much happy. I was also very happy. But when I got married and I had children, I wanted to be with them. I was confused that what should I do? What is my priority? I should see them, or choose my profession.
Hmm.
And that time, I was kind of confused, but still I was supported by my family. But I was always feeling, kind of confusion in my mind, because I used to feel I should be near my kids. So that was a very difficult time, and I suffered also, just because of me, not the situations that people never supported me, just because I at that time wanted to be with my children. I tried to balance it, because then I reduced my working hours. Then I spent time with my children also. I gave time, because when children are infants, till the time they're infants, they will remain in your lap. When they'll grow up, they'll go and see, find other people, they'll have more attachments. So this is the time they need you more. That time I reduced my working hours, and I accepted the truth that no, this is a time. If I can give them more time, I should choose that, because this time will never come,
Yeah.
and this is a growing time of, this is the base, this is the foundation of my child, and it should be very strong. Then otherwise, when they grow up, they understand, and they also can't tolerate you all the time. So the time I should have supported them, 4-5 years of age, till 4-5 years of age, I tried to balance. I reduced my working hours and I supported them, and my family also supported me so that I could not actually leave everything. So whatever work I was doing, I was able to do quality work. And then now when my children are grown up and they're going to school, I am glad they have become quite little bit independent and they understand my nature of my work. So now I'm back to my work. And
Yeah, wonderful. So my next question is related to that only. So you are a woman, you have been a girl, and you have been how you were raised and how you're raising your two beautiful girls. Uh, any difference or anything, anything you want to do differently? Any thought you had in your mind that, oh, when probably I'll have kids, I'll do it like this, and you're probably doing it now. So anything you have, that's any story to share there?
uh, actually, when I was raised in a family where I had brothers only, so I never found that I was treated, differently, or like that I should not do this. I never faced anything like the girls can't do this and that. So I could never understand it till the time I grew up and started living my own professional life. In my profession, I saw this, that people differentiate between females and males when they want to promote, when they want to evaluate your work. Uh, that they think that, oh, she is a female, why you want to promote her? She will be always after her kids. She calls her back her home thousands of times to know that whether her kids have eaten or not. So I saw this kind of behavior in the society, but not in my house. So I was very much sure that they are wrong. So, and regarding that, what will I do to my kids? I don't know. I feel that I should not have any control over somebody, because the kind of upbringing I got, they are not getting the same. They are different lives and their choices are different. My parents were different, their parents are different. So
Yeah.
they will have, I want to see what my husband's and my combination will grow up like.
Hmm.
So I just want to let them evolve in their own way. I just support them, or whatever I don't like, I just tell them I don't like this, you should not do this. I just see that they don't go in the wrong direction. And then when they like something, I just support it. I don't guide them. You should do this and that, because throughout the day I'm doing my duty. What is their learned behavior that they see that I'm so much passionate for my work? So I find that this is one thing, a learned behavior from me. They also want to show me that they are also equally passionate. Although I'm not told, but they're doing it the same way, and I like it.
I'm sure
i
they'll
think
open to.
you should not aim up being at some seat. You should be a happy individual with whom everybody should feel like uniting.
Hmm. Very nice thought.
Nobody wants a depressed prime minister. Nobody wants a depressed CEO. Nobody wants a rude some other administrator. But everyone wants to gel up with a happy, easy person who is balanced and peaceful in mind. And I want my children to be that. People will run after them. That way, I think in the coming time, people will run after balanced mind people who can give them a smile and who are peaceful at mind and can make their surroundings peaceful. So I just tell them, you just achieve this thing and rest is your choice. With
Hmm.
my advice, you should be a happy person, not a fearful, anticipating person, comparing person. You should be a peaceful person. If you're alive and pain free, you can do anything.
Exactly. I
Live
think
right.
that's the major difference between the two generations, our generation and our kids' generation. That probably we still we grew up in a different environment. These kids are growing up in a different scenario. So yes, and but that's a very nice thought there. That a person should be happy, a child should be happy, and automatically they follow what the most of the time they follow the what the parents are doing. What the parents are. If parents are passionate, if parents are
Whatever is in the
hardworking.
surrounding,
Yes,
whatever,
exactly.
even they learn from their friends. Sometimes their close friends, definitely they will learn from them. And then you will learn from them that they have learned something good.
Yes,
You.
Totally. I totally get that. So it happens most of the times that sometimes we think that as parents we are teaching them, but actually it's two-way process. The communication is both sides, and you learn, they learn, and that's how you grow together, I think. So about the professional part, you said that you saw some disparities, gender disparities, basically, वो male female disparity ratio देखा है, you've seen that. So what now you have worked for so many years and you had a higher role, and how do you probably want to give out a message to other women who are rising up in your profession, and they probably face similar issues? So any advice there, any message there?
My advice is that if people think, anything that the females are any less than men, that is their perception. That is their very personal perception in life, or there maybe their excuse. So don't listen to that. Keep on doing the good work. Nobody can stop you. And don't just let them say. Don't bother. It's just if you'll pay attention to it, it will matter. Otherwise, everything what goes on in your head matters, and nobody can stop you. Keep on doing the good work. Keep on doing the good work. You will face troubles. It's not like that you won't face troubles. If you will be surrounded by females, then you won't face troubles.
Yes.
You will face troubles. You have to keep fighting, going, moving. If your work is good, nobody can stop you. Nobody can stop you. If you cannot come through this window, some other window will open. Some third window will open. Upper floor will open. So don't think that if some obstruction is coming your way in the name of gender disparity, let it be and keep on doing the work. Wherever you go, people need good work. Nobody can, no association can progress without, competent people. At last, they need good work, and they cannot, if they let you go, then it's their bad luck, and you can definitely make a progress through some other plane, some other channel. So never get disheartened. This is a stupid thing, and in coming times, it will remain a story.
Right. So, I mean, very thoughtful and amazing words coming from you, and that's very inspiring, actually. So, any message to our audience?
I'm telling you, it never happened with me. Maybe it would have. I, never pay attention to these things. But I saw somebody, there was a very competent surgeon, and she was fighting for her salary band, and there was 1 year junior to him who was getting better salary than her. And what I got to hear that, oh, she is, she took 7 months of maternity leave. So she has wasted 7 years. How can you say that she's senior to me? And the management agreed.
Oh God.
But eventually it got solved. So this way, they evaluate your competence, your expertise, because she became a mother, so she was distracted. She can't be very perfect and professional.
Yeah, I mean, I don't understand. A woman, when she becomes a mother, she's actually taking up both the responsibilities of the work and the family life. Yet, that part is considered to be of some non-value to the corporate offices or other professional offices. So this is a really very pathetic approach, and I'm thankful that lady got her due. Otherwise, most of the offices, this is the scenario. I mean, a mother, she's not just a mother, she's a working lady who became a mother, and she's again handling responsibilities of her kids with her family and so many other things.
Because there is no substitution to mother, no?
But that in itself, it's a demerit. I mean, that's very sad. If people still follow that rule, that's very sad. That is one thing that is actually moving the world, and yet that is considered to be a demerit. So that's very sad, and I really hope that
it is confronted, if it is confronted very tactfully and lawfully, then these people have to apologize. They always apologize and take their words back, and the truth comes in front. And these are the all excuses, and these are the people are in a habit of pulling back the females.
So is it, we have still, we say that, okay, women are doing or women are progressing so much, but that is still very lesser amount, lesser ratio of the society as a whole. So patriarchal society, is it because probably there are male heads? Is that the reason? Do you think so? Or any other reason which you think about?
I don't know. I think they feel jealous and how can she manage so many things?
Insecurities. Okay.
Because they feel that, because maybe they would have seen very professional, hardcore female, and once she becomes mother, she has a very soft attitude. So people feel like they are very much vulnerable. This time we can attack her with words because you are emotional at that time. This is a kind of, yeah, obviously it's a low time. Every female is very, she's very much emotional. She is unable to control her emotions at that point of time. So people feel it the best time to attack them.
And I think that's the
But
period when postnatal depression, the term, it actually happens post motherhood, no? Right? If I'm actually right about that.
yes, because if the family or herself, the female thinks that my value, I'm not being valued at my home, or somebody is taking my place in the workplace, then they start feeling depression
Hmm.
because they could not focus on their child entirely. They feel that they are like as if they are missing life now. So it is in their mind, and they're not there are not right people who can guide them. People often tell them, "Oh, yes, now you won't be able to join ever, leave it." Or when people say leave it, you won't be able to join, then they throw their babies, and that is also part of depression.
Yes.
And they immediately join the office, and then they're filled with guilt,
Hmm.
and their health start getting affected because people are not guiding them right. They should tell them, oh, this is only 6 7 months, you just give it to your child, then you will be able to work so well because you will be a mother to a very strong child, when it's 1 year old child or 2 year old child.
Yes.
They tell them that this is your life now. So they become indecisive, and when they so early they join their office, their kids get sick because teething trouble starts. So people
Hmm.
start to blame them that just because you're not in the house, look, your child is not well.
No, what
Every
all
child
can a
will have
woman manage? There's so many
trouble.
things. What all will she manage? So
I
depression,
know.
getting to depression, it is still depression is a word there in science, but many people still don't think and they don't understand that when a person is depressed or not depressed. People usually don't identify with that thought. Ki, oh, you're depressed. No, 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 no. I'm just sad. It is happening. ये चल रहा है, वो चल रहा है, इसलिए I'm just sad. But वो depression का जो concept है, how would you how can one probably manage that as a woman, as a doctor? How would what would be your advice there, that how a person should probably
You
go through
think
that whole procedure?
postpartum or usually?
Both ways, maybe a woman most of the time I can see
Postpartum,
that. Yeah.
postpartum, you should not leave the women alone, because when your uterus changes its place,
Hmm.
when it is, not in place, it's down, it affects your mind a lot.
Okay.
So you can have hallucinations, suspicions. You will not believe it. This is natural. You won't believe anyone for your kid. Either this will go this way, or if you will feel that the environment is not good, some females could not feel any connect with the child
Hmm.
because they are not being supported rightly. So they don't understand that they somehow start feeling that I'm suffering because of this child.
Oh,
So
okay.
this time they need support from lot of ladies because they're sleep deprived. Body, every part is paining. So in ancient times, there used to be ladies who used to take care of the babies along with the mother
Hmm.
throughout the time. They were surrounded with many people. They used to see the light. Now people are sitting in closed rooms. So life becomes very much, they feel stuck. So that's why, just because of change of lifestyle and short families, people are facing these troubles.
Okay.
Women, when they live in, 4 or 5 women are living together, then they use energies, each other's energies also help each other. So the recovery is fast. कुछ लोग जिनके घर में होते हैं कि हमें पता ही नहीं चला हमारे बच्चे कैसे बड़े हो गए. And there are a lot of women. और जहाँ पे कोई न्यूक्लियर फैमिली है, कोई काम नहीं है, 2 बच्चे हैं, and the female is so much deprived, she can't eat, she has a lot of migraines, her behavior has changed. So all these things happen. So at this time, women needs a lot of support and rest. 6 months at least, she needs rest. It's right.
Okay.
Teething troubles, अगर आपके बच्चे के आप हैंडल कर चुके हो तो आपको you can leave your child safely with anyone.
Okay.
नहीं तो अगर उस टाइम पे अगर कोई प्रॉब्लम हुई टीथिंग ट्रबल की वजह से, if your child has suffered something, कोई माइलस्टोन कवर नहीं हुआ, टीथिंग नहीं हुई, नेक नहीं संभाला, तो you will want, you will feel guilt for life.
Yes, and it takes a lot of time to heal, not in just not just physically but mentally as well. Healing is a long process.
If you're babysitting, you are have postpartum, you are with your child, start reading, no, do some course. You can, there are ways, but sometimes their family conditions, some people feel that they were not given any importance, they were valued only with the money they earned.
Yes, I was coming to that only, because that power equals to money. That power equals to money equals to fear. So with no money, there's no power, and there's lots of fear among women. And it's still there.
They should have some good friends who should tell them that this is only the time, you just see everyone, and then when everything will be fine, your kid will be 1 year old, you will get up and you will make money again because you're intelligent. Yes. You're healthy.
But no, mostly they'll be told कि oh no, अब तो तुम्हारा career खत्म हो गया है. अब तो
Don't believe anyone. Don't believe anyone. Don't believe anyone. Believe in yourself only. People are only saying to you according to the experience they have. Maybe they are not as courageous as you. So you should have a good social circle. You should keep meeting your friends, talking to your friends. If you should have friends with, children of same age. They can keep you motivating. So this is how
sharing and caring comes together. You should meet, you should share, and you should care.
Social circle is very important.
Okay, that's right. So when you are not in the hospital, when you are not with the family, women usually, I think, suffer from that personal space. They don't have any personal space. Either it is work or it is family. So what do you like to do in your, do you have that freedom of having a personal space, some time alone for yourself?
Yeah, yes, sometimes.
So what do you like to do? What do you enjoy?
Actually, I enjoy reading a lot. So even I'm alone, I will read some book or I will listen to something. So sometimes I, feel like that I have to go somewhere and then I make a move now.
And you're also a trained Bharatnatyam dancer.
Yes, I dance a lot with my children. I sing a lot. Even if I'm in the bathroom, my kids are outside. Just to make them laugh, I, sing in a different way and louder, and I tell them to copy me. So just being kiddish is, just spread a smile like a kid. So they enjoy my company then. Then I'll sing songs or I'll dance. I don't keep serious all the time. Once I'm home, then I'm just of their age. They tell me, how can you do this? You should not do this. Come on, stop it. Fun.
That's so cool. That's so cool. That's amazing. It was such a rejoicing session with you. We were able to know so many facets of your life as a doctor, as a mother, as a household person. And yes, personal space, of course, is very important. So any concluding message to our audience? Anything you would want to suggest or you want to share as an in conclusion message?
I want to share that you should be first clear in your mind what you want. Then only you can make a move for that. You having 4 things in your mind, you can't move to any direction. If you are clear in your head what you want to do, then you can, everything, nature will set things for you. Otherwise, I have, seen females, I will tell them, you come in the evening, pick up your medicine. वो मैं आ नहीं सकती. मुझे उनका ये करना है. Nobody is stopping her. People in her family will tell me nobody is stopping her, but she in her mind is occupied. So just be clear in your head what you want. You have to do everything for your own self, and first step when you will make, everyone will help you. You can't, you can't expect that people will make the first move and then you will say no, 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 and then yes. If you are clear headed, then only you will be supported. So be clear in your mind. Don't sound stupid. Be clear and persistent in your efforts. Then everyone will definitely help you.
Wow, thank you so much for this beautiful session, Mini Mehta. And we hope that you grow in life with the positive thoughts that you're already spreading. I'm sure I got a lot of confidence after seeing the session of yours. And I hope we'll be able to spread more positivity among these difficult times specifically. And best of
Sure.
luck, best wishes for your future. Thank you so much, Dr. Mini. And thank you, our audiences. We will be back again next week with another guest. Till then, please take care and be safe.